Although tooth fracture is less common in primary teeth, it may still happen. Generally, there are two types. Uncomplicated is a clean fracture without any damage to the blood or nerve supply. These fractures can often be left. However, a complicated fracture is when the pulp is exposed and you see blood. These teeth are susceptible to infections and nerve exposure, and they may need to be extracted. In all cases, whether a child has a luxation or a fracture, you'll want to insist the parent brings their child to see a dentist. The dentist will perform tests and take radiographs to ensure that there are no complications such as root fractures or infections, and they can also fix the aesthetic of the tooth. Preventing these traumas can be challenging, but implementing household safety, such as stair gates, trip hazards, and supervision, could help reduce the incidence and severity and is something you could suggest to parents.
Moving on to Objective 3. We've been hearing so much about prevention of the coronavirus lately, so the last type of prevention you'd want to learn is how to prevent caries in children, but bear with me. The key to oral health and the prevention of caries of children lie in the hands of their primary caregiver. It is important that the primary caregiver starts good habits of brushing their children's teeth. Circular scrub is a recommended method, however, as long as the teeth are thoroughly cleaned, that is more important. Here's a video on how a parent brushes their child's teeth.
Sitting down in a chair and sort of cradling him in your arm and brushing that way. You can be standing behind him, or if it works for you, you can kind of have him right in front of you looking at him. You can be sitting on the floor with him and have him laying back into your lap, as long as his head's stabilized and he's opening wide, and that you're able to see all the teeth and reach all of the teeth when you brush.
The toothbrush at a 45-degree angle and move in a gentle circular motion. Clean 2 or 3 teeth at a time, and then move on to the neighboring teeth. Gentle circular motion. Here I'm doing a demonstration on a younger child. As you can imagine, it takes a lot more effort, and I need to do a lot more distraction in order to be able to properly brush his teeth. The technique is the same, so I am trying to place the toothbrush at a 45-degree angle towards the gum line and either do the flicking motion or the gentle circular motion.
If they are unable to brush their teeth, at the minimum, wipe the gums and teeth with a wet gauze or towel. Older children can start brushing their teeth on their own when they are able to perform more complex tasks. It's important that even if they know how to perform these tasks, supervision is necessary. Continuing on, fluoridated toothpaste should only be used when your child has teeth. The amount of toothpaste is a balance between caries prevention and a condition called fluorosis. This is due to ingestion of too much fluoride before and during tooth eruption. Though toxicity is rare, in high amounts, it can actually make the tooth structure weaker and more susceptible to caries. Therefore, additional fluoride rinses are not recommended for children. Lastly, drinking fluoridated water is safe and great for caries prevention. At the dentist, high-risk patients can receive one or all of the following treatments. When there is a cavitation on the child's teeth, a quick way to arrest the cavitation from getting more severe is by the application of silver diamine fluoride. The silver has an antibacterial action, and the high fluoride content can help remineralize teeth. This treatment will turn the decaying tooth structure black, but not the sound tooth structure. Another treatment is fluoride varnish. It is a gel with high fluoride concentration that is applied on teeth to help remineralize and prevent decay. Studies have shown a 20% reduction in caries with this treatment, and it can be applied by you as a healthcare practitioner who isn't a dentist or a hygienist. Lastly, dental sealants are strong materials used to fill in deep grooves and pits, often in the molars of primary teeth. Studies show it reduces caries risk by 80%. Avery will now talk about our last preventive strategy.
Another key factor in prevention of caries is diet. There are 4 main ways diet can be utilized to reduce caries risk. Firstly, reducing the frequency of snacking is highly effective in prevention. Secondly, ensuring you are eating high-quality nutritious food can prevent caries. For example, focus on eating foods rich in protein and dairy whilst avoiding food rich in carbohydrates. Thirdly, the texture of your foods can impact caries risk. Stickier foods, such as gummies or chips that adhere to the tooth surface, should be avoided. Finally, drinking water can be an effective tool in preventing caries. For example, by drinking water during and after a meal to help cleanse the tooth surface. Furthermore, parents should not allow children to fall asleep with a baby bottle. If this cannot be avoided, water should be the drink of choice. Brianna will now be running through a case study.
Now we are going to review a case study to demonstrate how you could apply risk factors and preventive measures. A 4-year-old boy comes into your office with his parents, and you discover that he has 4 restorations, he brushes his own teeth without supervision once every morning, he frequently has sugary snacks, and he drinks apple juice every night before going to bed. Upon visual inspection, you can see plaque and white lesions on his teeth. The goal is to be able to identify risk factors that make him a high-risk patient for caries. If you were asked to determine which of these risk factors make him a high-risk patient for caries, A. Past caries experience, B. Plaque on teeth, C. Frequent snacking, or D. All of the above, you would be correct to say that all of the above are risk factors that make him a high-risk patient for caries. Now, with the same patient, you want to be able to identify preventive measures that would improve his risk for caries. If you were asked which of these preventive measures would improve his risk for caries, A. Using a large amount of fluoridated toothpaste, B. Brushing with his parent using circular scrub technique, or C. Replacing sugary snacks with healthier and less sugary alternatives, you would be correct to say that B and C are the correct preventive measures.
Before we wrap everything up, we wanted to provide you with this additional resource. You will have parents bring in their children who cannot afford dental care. Luckily, these children might be approved for Healthy Smiles Ontario, which is a program funded by the provincial government to provide children in low socioeconomical status families with scalings, checkups, and dental treatments. If you have any questions, please visit ontario.ca/healthysmiles for more information, or we will be here after if you want to talk about it. So what did you learn today? You learned to take a closer look at the teeth to determine if a child is showing signs of carious lesions. You were able to identify multiple risk factors that would put a child at risk for poor oral health and caries. And lastly, you learned how to help your patients and their parents prevent caries and achieve those beautiful smiles. Thank you for watching our presentation. If you have any questions, please feel free to stay after and you can ask, or you can send us an email. Also, if you would like to give us your feedback, you can scan this code with your phone. It's about 5 multiple choice questions. Have a nice day, everyone.